Hi, I'm Casey Fry, and with me today is Bill Galvin, Assistant Professor and Program Director of the Respiratory Care Program at Gwynedd Mercy University. Today, we will be discussing the profession of respiratory therapy. Okay, so my first question for you is, could you explain to us exactly what the medical field of respiratory therapy is?
Okay. Respiratory therapy is one of the faster growing allied health programs that we have in the healthcare system. It's very fast paced, very high moving, very highly technical in nature. But basically what a respiratory therapist does is work with patients that have any kind of a breathing problem. The organ systems that we get directly involved with would be the heart and the lungs. And so anything that's associated with that would be an area in which the respiratory therapist would be involved. And right now, the Bureau of Labor Statistics indicates that there's about a 26% increase in demand for respiratory therapists over the next 10 years. So it really is a high growth area, despite the fact that most people don't know what a respiratory therapist is. And we also like to emphasize the concept of high tech, high touch, because we're finding that a profession like this is highly technical. There's a lot of complexity and a lot of complication to the technology that we're involved with in terms of the patient and the use of the equipment on the patient. At the same time, we need to make sure that our individuals, our students are prepared to be caring and compassionate individuals, and that's how we kind of connect the two, where you're working with the technology, but at the same time being mindful and sensitive of the fact that we've got to be caring and compassionate to the individuals.
Okay, so what is it exactly that a respiratory therapist does?
Okay. Respiratory therapist will really work with patients across the entire healthcare spectrum, from the very, very young all the way up to the very old. And I can give you a couple examples by just looking at the different age groups. The younger group, the infants, the primary issue that we deal with there would be prematurity. And when an infant is prematurely born, the body really hasn't had the time to fully develop and to grow. And so one of the major organ systems that's affected when that occurs is the lungs. And so the lungs are born prematurely. They're very, very stiff. They've really not had the time to develop fully. So in many cases, the individual, the infant's going to be needing to be placed on mechanical ventilation. So a respiratory therapist would be the person who sets the ventilator up and maintains that. So it's a pretty high tech, high involved, high level of complexity in terms of what they do. And once the baby, comes to full term, then the ventilator can be discontinued, and usually the stay is relatively short and the baby goes home. When we look at that next group, though, the child, the adolescent type, they were looking at things such as asthma. That would probably be the biggest disease state that we deal with. And when we talk about asthma, we're really looking at things like the fact that the airways have gotten much smaller in size because of a number of things, one of which is what we call bronchospasm, where the muscles that surround the airways are constricting and squeezing down on them like a snake would be around a tree, and it would pull down, making it more difficult for the individual to breathe. We also see a tremendous amount of swelling and inflammation that's occurring within the airway itself. And then finally, the third thing really is the secretions. There's a tremendous amount of secretions that are being produced, and the combination of those three really does represent a very, very small, narrow opening from which the air is able to pass. And so respiratory therapists would be people who would be involved in correcting those. And we do a lot of work with different respiratory drugs and medications that would allow the individual to have their airways expanded and opened, and we use what are called bronchodilators. And so respiratory therapists would be involved in the delivery of medication, either with the little handheld devices, the meter dose inhalers that you'll find people carrying around with them, or some of the devices that put out a larger output of medication. But that population of people primarily are dealt with in terms of treating needing to understand how the medication works and the delivery mechanisms as well. And then the population above that would be the individuals who are maybe in their teens or early 20s or whatever, and unfortunately sometimes we find that they're more of a high risk group of individuals in terms of their being more adventuresome, and unfortunately we see things such as motor vehicle accidents, which is very, very unfortunate. But trauma is very prevalent, and high level of accidents are very prevalent in that age group. And so the role of the respiratory therapist in the treatment of that would be primarily dealing with CPR. with cardiopulmonary resuscitation. And I actually brought a few items along with me, one of which is this little model that we have here. It's pretty neat to show the students this because you get a chance to see the actual size of the heart, which is about the size of our fist. And basically what happens is when you're doing CPR, the heart is in between the spine and the backbone there. And basically what you're doing is pushing the sternum against the spine and it's squeezing the heart, and that's what's moving the circulation. So that's the circulation part of it. But we also have the A and the B, airway, breathing, circulation, the ABCs of CPR. So a respiratory therapist is taught how to maintain the airway. And we can do that by placing what we call an endotracheal tube. It would go either through the person's nose or mouth, and that's placed in the trachea. And then when we inflate the balloon on the other end, we have the airway established right here. And all we need to do really is to use what's called a manual resuscitation bag as a way to place that here, and then we can do the B, the breathing of it. So you have the airway, the breathing, and then the circulation. And I think the key thing to tell our audience is that the respiratory therapist really is a key player here because they are always going to be a member of the code team that's responsible for doing that. So we need to spend a lot of time with our students preparing them to do that because it's a real big role of what they are involved in. In addition to that, we also have simulators, which you can see are right behind you. One is the ventilator, and then we also have the simulator, so we can actually demonstrate and mimic and imitate a real live code here at the college, here in the lab, and then the students are better prepared to go out and actually perform those procedures on the patient. So we have basic cardiac life support as well as advanced cardiac life support, which is done on that population. The last two groups that we get involved with would be the middle-aged individuals, and some of the primary problems we have there would be pneumonia or bronchitis. Basically what we're doing there is helping them breathe better by helping them eliminate and remove the secretions as well as the medication that they're getting to combat the pneumonia. The last population, though, is the elderly population, which is by far the biggest population that we deal with, and that would be the COPD group. And I just wanted to mention that COPD, unfortunately, has become the third leading cause of death in the United States. So that has become a real issue for many of us in terms of treatment and care, and I think it has really brought the field of respiratory therapy alive in terms of being more prominent and being more well known to individuals because of the role that we play. But the COPD population would require what we call pulmonary rehabilitation. So what we do is we help the patients with their medications. We help deliver oxygen to the patients as needed. We also teach them how to breathe more effectively and efficiently. So all of that comes together, and it does help improve the quality of life for the individual, which is really what we're trying to do. So you could say it really does cross the entire spectrum from the very young to the very old.
Yeah. Okay, so could you describe to us the typical education that a respiratory therapist receives?
Okay, there's two levels of education that are in play right now, if you will. One of which is the associate degree, and the second is the baccalaureate degree, the bachelor's degree. I would say that probably 75%, three-quarters of the schools in the United States are offered at the community colleges or the junior colleges, and they would provide associate degree education. I think it's important for people to realize that the minimum requirement of education really is the associate degree. And it's not terribly different from what nursing is. Nursing actually has the same requirement. They're mandated to have a minimum of an associate degree, but at the same time, many of the programs are going to baccalaureate level. We're kind of going the same direction. We recently had a consensus conference in which we took a look at ourselves and decided, what is it we're doing, what does the future hold, and what educational needs will be in play as a result of that. And we really clearly have seen the need for the baccalaureate degree. So right now we're seeing a lot of articulation agreements starting to be formed. We have a number of them right now with some of the community colleges in our locale. And what we're doing is we're allowing, obviously they're completing their associate degree, but they can transfer and come to us and complete the baccalaureate degree, which is really going to be that upper level that we're looking at right now. A lot of that is tied to the scope of practice, which is something I think you were going to talk about a little bit later on. But clearly we're going to see the need for that expansion of the curriculum, so we can see have more opportunity to get into the research areas, to get into the psychosocial aspects, which is very difficult to do at a 2-year institution. Only the 4-year schools really have the additional time that's required to embellish that and to provide more education.
Absolutely. So I know you mentioned a couple common things that you work with as a respiratory therapist, but are there any other common lung diseases that you treat, and could you tell us a little bit about the treatment approach that you would take in caring for patients with those diseases?
Sure. Probably the most prominent one that people hear is COPD. COPD is getting a lot of visibility on TV and in the marketplace right now because there's a tremendous increase in the number of COPD patients. It used to be that COPD was about the 4th leading cause of death. It just recently became the 3rd leading cause of death in the United States. So it really has changed the entire healthcare system, and the whole issue of the attractiveness of a respiratory therapist and the visibility of the profession, because we're so much more involved now than we were before. But COPD is probably the biggest one that has had the greatest impact in our profession in terms of our getting involved with patients. Generally, these are patients who are pretty debilitated. They're in that 65 or beyond stage. We're needing to do a lot of work with them in terms of oxygen therapy, in terms of teaching them how to breathe better. Pulmonary rehabilitation is what we call it. And so there's a lot of assistance that's given to them with that. In addition to the medications, which is the other big area would be asthma. And I think that's what most of the public would be familiar with. But in the case of the asthma patient, there really are 3 things that are going on there. You've got a patient who has what we call bronchospasm, which is a constriction of the airway because of the smooth muscle that lines it is constricting and pulling it together. And then you've got the swelling of the area that's inside that. In addition to that, you've got a lot of secretions that are being produced. And all 3 of those things together will really reduce the size of the airway. And it's probably best to liken it in terms of trying to breathe through a straw. When you've got a very, very small area from which to get the gas in and out, it makes it very difficult for people. And so you want to find a way to do that. So the medications, the respiratory medications that we're now spending a great deal of time with are the things that we really are highlighting for our students. And in addition to that, the mechanism of delivery, the aerosol delivery devices are becoming very important as well.
Mm-hmm. So earlier I believe you mentioned an expanding scope for respiratory therapists. So can you tell us exactly what is the scope of a respiratory therapist, and do you foresee that definitely expanding within, say, 5 or so years in the future?
Sure, absolutely, yeah. I think traditionally respiratory therapists really did 2 things. They were clinicians, which means that they provided therapy, at the bedside, and that could be in the form of oxygen delivery using the nasal cannula device or other devices that we have. Use of aerosol devices and giving breathing treatments, if you will, and all the way up to mechanical ventilation. So it was a pretty wide range of therapeutic procedures. But in addition to that, diagnostics was the other area we were involved. And this way we would, in this capacity, we would have the patients come to the pulmonary function laboratory and they would actually do a study. And with the study, they were able to determine whether they had an obstructive disease or what we call a restrictive disease. And then based on that, we can take additional action in terms of how to care for the patient. So I think historically that's been kind of a traditional role that a respiratory therapist has played. What we've seen in the last few years and what we're seeing in the future are the growth of patient education, for example. So there's a major role for the respiratory therapist to be a patient educator. And so that is where we need to get involved in the psychosocial aspects of medicine. And I think the baccalaureate degree will allow us to provide more education in psychology and sociology and understanding how the body, not just how the body functions, but how the mind works as well, because you're really starting to take on the role more of a counselor in addition to the idea of just providing the care. So I'd say patient education is a big area of growth in the future. We also are very, very involved in patient advocacy. So now we're looking at patient navigation, patient navigator, patient advocacy are 2 big areas that are under development right now. Care coordination, serving as a disease manager, where you're looking at the entire spectrum of healthcare and looking at a particular disease in a population of patients and then putting together care plans for them. that they could follow. And so that seems to be a high growth area. Research is now another area that's being used, that's being developed very heavily, and respiratory therapists are getting involved in that. And once again, the upper level of education, when you talk about a baccalaureate degree, you'll find that the individual is better prepared to serve in that capacity. I guess the other area is sleep medicine, which is another big area that's being looked at right now in the system. There's an awful lot of patients that are walking around that do have sleep apnea problems, and so there's a lot more work being done in the diagnostic area. And so respiratory therapists are very involved in the use of CPAP units, which is the primary device that a lot of people are using to treat obstructive sleep apnea, which is a really growing problem right now in our society.
Okay, so people are living longer for sure.
Mm-hmm.
And I think that creates a focus on advancing geriatric medicine. So could you tell us, do you foresee the role of the respiratory therapist changing relevant to that focus on advancing geriatric medicine?
Mm-hmm. Clearly that's going to occur, and I think you've hit upon something that's really important. I don't have the exact figures in front of me, but as I mentioned previously, about 12% of the population were 65 years of age and older, and that was probably around 2000 or so. And I think if you look at today, you're talking about 15-16%, with projections that go up into the 20s, the low 20%. So there's this huge shift and this graying of America phenomenon that's occurring. And I think we really have a geriatric imperative in front of us, because we're going to see this huge shift occurring. And so the geriatric population is really going to be the group that we're looking at. But I think what they bring with them is this issue of chronicity. So chronic debilitating diseases really are the ones that are going to the top of the pile, so to speak, in terms of needing care. And so respiratory therapists will be so much more involved in that kind of care than they have been in the past. I know that estimates sometimes are as high as 75% of the population of patients that are in the hospital are over the age of 65. So if you take a look at who's lying in that bed, you're going to notice that they're the elderly patients, and they really do have unique needs. And senses obviously start to falter, as they get older, and in terms of hearing and seeing, and the body degrades. Obviously, it starts to decline, and so there'll be a lot of emphasis on caring for that group of patients. And I think even the natural, normal aging process comes into play, and so we have to be a lot more sensitive as a healthcare individual to work with patients who have those kinds of issues. But I do clearly see that along with the COPD population is going to be the thing that's really driving the popularity, if you will, and the need for a respiratory therapist in the future.
Mm-hmm. Okay, so could you tell us how patients can protect their lungs and how they can practice good lung health?
Okay. I think the obvious answer to that question really is going to be the issue of smoking. And I think we start to see a lot of progress with regard to smoking, but we still have a large number of people that are doing that. And unfortunately, the smoking dilemma, that was in existence years ago, has really started to make the COPD population get larger. So I think that's what's driving that. And so unfortunately, the people who years and years ago were not made aware of the consequences of smoking are now starting to come into the physicians' offices, into our clinics, and into the hospital receiving care. So we just have to do a much better job educating people about that. But it's pretty tricky when you talk about that issue of smoking, because I think most people know and understand the consequences of it. But the key thing is really getting them to be motivated to change, and also to go through the change modification, the change behavior, which is pretty tricky as well. But respiratory therapists are taking a very active role at the bedside doing smoking cessation, and we actually have credentials that people can get in the area of tobacco cessation, and there's a lot of good science behind the methodology that one can follow. But the real answer to that question, though, is the issue of smoking and pollution, really. I think we have to be very mindful and more diligent with regard to being aware of the consequences of a lot of the things that we have. I know just recently I've seen some videos, and I was involved in a program that was being looked at in China, where they're looking to have respiratory therapists to get more actively involved there, and they've been soliciting our assistance in this country to go there and to help them. And I remember looking at the videos, and you can hardly see in front of your hand. The smoke was so bad and the pollution is so bad there that you can see that they've got a problem that's really growing. It's going to be monumental, and so they really need to invest in that, really, and they have to make some tough decisions. And I think it gets into the corporate world, obviously, in business and industry, but nevertheless, it is something that needs to occur. But pollution and smoking really are the two key variables that I think that we need to make people aware of, and I think it's just constant, education to the population about that.
Yeah, absolutely. Okay, so lastly, could you tell us a little bit about your program here at Gwynedd Mercy?
Sure, be happy to, yeah. Gwynedd Mercy University is a wonderful institution, really. We have a lot of things going for us. I think our major emphasis really is in the area of healthcare. We do that, I think, very, very well. But in terms of respiratory care, we have a relatively small program. We keep our numbers small. We really are a big believer in the idea of personal contact with the students, so we keep the ratios relatively low. The other thing that we do is we continue to have both an associate degree and a baccalaureate degree, which I think positions us very well for the future, because when the program, and when the profession, I should say, moves in the direction of mandating a baccalaureate education, we're really well positioned to be able to do that. But right now, the way we have it structured is we have a 3-year associate degree program, which allows us to be true to our vision and our mission of liberal arts education and service to society, which is a big emphasis on what we do, because we are a Mercy institution, and we obviously believe very heavily in care and compassion and really trying to form the individual to be sensitive to those kinds of things. But the program itself is very heavily emphasis in the area of sciences, anatomy and physiology, chemistry, physics, microbiology. All those things are a very, very critical part to the curriculum. And then when we get to the respiratory care component, we've got about 50 to 60 credit hours just in the respiratory care area, so it's very intense. And the structure is basically classroom teaching followed by laboratories, followed by clinical. And so the technology that you see around you, the simulator, for example, is a big part of what we do, because we feel that if we can do a lot of the simulation work here, then the students are better prepared and more comfortable to go out to the clinical, where they're actually going to interact with the patient. And then when we get to the baccalaureate level, we start to stress more of the areas of research, the psychosocial aspects. So we try to do a lot more work with their developing really good, solid communication skills, decision-making skills, being more analytical. And I think you're able to do that if you make the program and the curriculum a little bit more robust, if you will, with those areas. And I think that's what we're doing in terms of preparing someone for the future, because we feel that the respiratory therapist will be a lot more independent and functioning independently, obviously assisting the pulmonary physician along the way, but being able to do some more decision making on their own and be better prepared to solve problems and put together care plans, those kinds of things.
Absolutely. Well, thank you very much for taking the time to talk to us today. We've certainly learned a lot about respiratory therapy.
Thank you, Casey. Thanks for having me.